We've got the power, DNA. Kate Wilson here with another episode of All Access DNA. I am constantly in awe of the power of parents to make a difference, not only for their child, but for other children facing similar medical conditions. Today, I talk with Dr. Heather Gatcombe, an assistant professor and radiation oncologist, about her son who has a mitochondrial condition. Several years ago, her son went into heart failure and had to have a heart transplant. We also discuss the future of a life saving medication that is currently in jeopardy with the FDA. Check out the show notes to find out how you can help. Let's get started. Well, thank you so much, Heather, for being on All Access DNA.
Thank you for having me.
You're a physician and a mom with 3 kids. You've lived on the other side of medicine after navigating your child's mitochondrial disease, heart failure, and transplant journey. So that's a lot, right? So tell me more about that. How your child was diagnosed with a mitochondrial disease, and what was it like going from somebody providing medical care to somebody receiving medical care?
Okay, so it's not fun being on the other side of medicine,
Mhm.
as you know, and sitting in that chair. It took
Mhm.
us several years before we actually got a definitive diagnosis. So when he was in second grade, and backing up, he had met all of his milestones and he was an athletic kid. He was a little overscheduled because he's my kid and he was my first kid. And he was involved with all the sports and all the activities. And then I received a call when he was in second grade
Mhm.
that said, "We think your son had a stroke."
Oh my
And
gosh.
out of nowhere, I was at work, my husband was at work, and I didn't know what that meant. And it didn't make sense. And so I remember rushing to the hospital, just everything going through my head and calling
Mhm.
everyone in neurology that I could think of. And actually one of our best friends happened to be on call. He was the pediatric neurologist on call.
Mhm.
So what happened was he went up to his teacher saying his hand kind of felt funny. It felt numb.
Hmm.
And then his teacher noticed he had a facial droop and he couldn't move half of his body. So
Oh
he
my gosh.
actually half carried him to the nurse's office. They called 911. By the time the
Mhm.
ambulance arrived and they assessed him, he was actually back to what appeared to be his normal self. Like it
Mhm.
only lasted about 30 minutes or so. So he went to the emergency room. We met him to the emergency room and I walk into this room and my smiling kid was there. He looked like he always
Right.
does. And we didn't know what was going on. And all the testing initially was negative. And so our
Mhm.
friend, who unfortunately was the one who had to tell us all this, said, this is probably maybe an atypical migraine. Maybe it's a hemiplegic migraine
Mhm.
where people can get weakness. And that's what they thought until we had a brain MRI and a brain scan, which
Okay.
showed some changes in the gray matter of the brain. And once they ruled out toxic exposure and
Oh
rare
my gosh.
conditions, we were labeled as this is probably mitochondrial disease. And then we were waiting on the genetic testing, which actually came back negative 3 months later. So my husband and I didn't quite buy it. It didn't make sense to us. I mean, we're both in science, we both went to med school and we didn't believe a diagnosis without having the data to support it.
Right.
So we had that label, but we were still trying to figure out what was going on. So we were getting second opinions. And then he started having more symptoms a few months later that made it more suspicious that he had mitochondrial disease. So he actually failed his 8-year-old hearing test, which surprised us because in conversation we didn't notice a difference in him hearing us and in just conversing. And then he had another metabolic stroke where he couldn't move half his body. And then this time he couldn't speak. It was much worse than the first one. And he was admitted to the ICU. My husband was actually on the way to Australia where he was about to give a talk. And so he landed with all these frantic emails saying,
Yeah.
as soon you got to come back now. He had just landed. I'm laughing about it now, but it was really horrible.
I was
You
gonna
have
say
to,
I can't even fathom, like, as you were naming, like, they evaluated him for this and it wasn't this. So it's like a whole laundry list of honestly terrifying things, I am sure, to hear that your child potentially may have. And then like you said, They're just crossing things off. There's not anything that's come back to
Hmm.
say, yes, for sure, definitively, this is what's happening.
Exactly. So he had an LP, and so his CSF was negative, his blood work is negative, his genetics was negative. But the picture, just for the doctors that were familiar with seeing mitochondrial disease, it was suspicious. And it was more
Hmm.
suspicious when he started developing the hearing loss, because that is common in patients with mitochondrial disease. And then when this episode occurred, and it occurred when he was on the playground, and it hit into someone and actually fell down and hit his head. So the MRI basically showed the same thing. But it was 2 years before he had a muscle biopsy that showed that this was mitochondrial disease or mitochondrial depletion. And then they would rerun the genetics every 18 to 24 months because, as you know, there's always new mutations that are
Hmm.
discovered. And it was 5 years after his initial symptoms where they found the cause. They found something in his nuclear DNA that had
Hmm.
just been published in a few other patients in England at the time.
Wow.
And it felt better knowing why he was having this so we could help him. So again,
Hmm.
there's no cure, there's no FDA approved treatments, but at least we were able to get in to see specialists who could help us manage what was going on.
So it was one of those things where, again, it doesn't necessarily say, oh, here's like when you take a car into a shop, here's what's going on. Here we've run the diagnostic, boom, do this. Okay. No more mitochondrial disease. But it does allow you access to some of the specialists, to some of the support potentially that you would need. One thing I want to explain too to folks listening is what is a mitochondrial disease, so they have a better sense of it. Because I think what's interesting is I find even people that don't work in science, the one thing they take away is the mitochondria is the powerhouse of the cell. That's
Yes.
the one thing they seem to remember. But what is mitochondrial disease? And because you mentioned a few different things that it does affect, like the brain and hearing and some other things as well.
Yes. So as you may or may not remember from high school biology or college, so your mitochondria create energy from the food that you take in and the oxygen you breathe. So they're creating ATP. And so you need that energy for your body to function. So if your mitochondria aren't functioning well, then your cells may not function well, your organs may not function well. And especially in times of stress, what we call metabolic stress. So if you're fasting or exposed to an infection, it can actually lead to even organ failure. And in severe cases, these metabolic crises can actually even lead to death in severe cases. So, mitochondrial diseases are when there's a mutation either in your mitochondrial DNA or your nuclear DNA that causes your mitochondria to not function as well.
And so that's what you were saying is with your son, it was nuclear DNA. So the nucleus kind of is the brain of the cell, going back to the
Mhm.
high school biology. And you have your DNA there, but some of that DNA does impact what happens in the mitochondria because mitochondria are separate from the nucleus, but they have their own DNA as well, which kind of makes them somewhat unique in the cell.
Yes. Yeah. So there's a circular DNA that you inherit from your mother. The mitochondrial DNA has about 37 genes, but there are over 1,500 nuclear genes that support mitochondrial proteins and functions. So if those are affected, that causes mitochondrial disease. And your nuclear DNA come from both parents, so from your mother and your father,
And the mitochondrial DNA, it just comes through the mother, correct?
just from your mother. Yes.
Okay. But because it comes through your mother, it's not, doesn't just affect women, it can affect anyone because all of us have mitochondrial DNA.
Yes. Yes. From our mother who created us,
Hmm.
along with
Okay.
help from the father.
Yes, yes, yes. But is that, I mean, do you think that's why it took time to find, I guess, the DNA cause for your son because it was nuclear, not mitochondrial, but it was impacting the mitochondria. And it was just like technology on just had to kind of like catch up to being able to evaluate both kinds of DNA?
I think that's a really good question. We've only known about mitochondrial diseases for the past few decades, so we're still learning about them. And so
Hmm.
we're still finding what is the cause, like which DNA mutations are causing them. I'm in the field
Mhm.
of oncology. It's the same for breast cancer. So many people are familiar with BRCA, BRCA1, BRCA2,
Mhm.
but now we now know there are so many other genes that can put you at risk for having breast cancer as well. And so with time and science and following patients, we learn more. And so when we first found his mutation, there were only about three other patients from, I think there was a case series from Britain. Since
Mhm.
then, there have been a couple of other case series. They've since published one with our son. So with time and with reanalyzing his DNA, they finally found it.
Mhm. Mhm. And I know that you talk about how your son had heart failure, had a transplant. How does the mitochondrial disease cause that? Like you said, and unfortunately, in some cases, it can cause death. So how does that happen?
Mitochondrial disease can present differently in different people, but there are mitochondria in every cell of your body except for your red blood cells. So it could potentially affect any organ in your body, but the organs in your body that require the most energy, so the heart, your skeletal muscle, your brain, and your nerves are most commonly affected. The brain alone uses 20 to 25% of the energy you produce. And then the brain, nerves, heart muscle, and skeletal muscle use more than half. So,
Mm.
in most patients with mitochondrial disease, the brain, the nerves, the heart, and muscle are commonly affected, but it can be different from patient to patient, even in family members with the same diagnosis. So, cardiomyopathy or other heart effects like cardiac conduction deficits can occur in many patients with mitochondrial disease. If your mitochondria in your heart cells aren't working well, they're not functioning well, especially in times of stress, it could lead to heart failure. The heart can dilate, it may not contract as well. And that's how patients can develop heart failure with mitochondrial disease.
Did your son did that happen before or after you had the definitive diagnosis of
So,
mitochondrial disease?
good question. So he had had the definitive diagnosis, and then this happened about 2 years later. So we found a great team. We go up to the mitochondrial clinic at CHOP that sees both
Mhm.
adults and kids. And so we found an amazing team up there. They started him on some supplements, and he had actually been symptom free aside from hearing loss for about 2 years.
Mhm.
And we were actually, so when you have a diagnosed mitochondrial disease, they want you to see all the different specialists because it could affect your eyes, it could affect your kidneys, your heart. And so we were getting pulmonary function testing, and he was seeing a retinal specialist. And we were seeing a cardiologist. And he actually had had an echo a few months before he was diagnosed with heart failure that was completely normal. He had an EKG that showed maybe something, but they thought it may be just a benign variant. So we also got a Holter monitor where they watched his heart rhythm for 24 hours, and that was fine.
That was
And so we were
normal.
told everything looks good.
Right.
And then everything happened pretty quickly about 2 months later.
Oh my gosh. So how did I mean, was it something like it happened at school again, or were you guys at home? Like, because it sounds like that's the thing is you've done the screening, you've followed with the specialist, you're doing the things that you need to do, but then this still can happen.
So we were actually on a family vacation. We were in Hilton Head. And it all started off where we were biking. And if you've ever been there, it's very flat. It's a great
Mhm.
place to bike with family and kids. And we had just eaten at one of our favorite seafood places, and we had only biked maybe a block or two when my son was like, "I'm tired. I need to stop." And so we're
Mhm.
like, I didn't know what that meant at first. And then by the time we got home, he threw up. So we thought, okay, he's sick.
Mhm.
And we were home like a day or two later, and it was 2021. So all the sick visits were telemedicine.
Right.
So they said this is probably a GI virus because he had an upset stomach. He was nauseous. And then when it didn't get better, we did a rapid COVID test, which was
Mhm.
negative. And they're like, well, let's put you on a wait list for a PCR test because it could still be positive. So they were still
Mhm.
thinking virus, maybe COVID, but he wasn't getting better. So my husband took him to the emergency room. We thought, oh, we'll get this PCR test. Maybe he needs some fluids. I was dropping off our younger two kids at school.
Mhm.
And then he called me But the second worst call I've gotten, and my husband was, I mean, he was crying on the phone. Like I knew
Yeah.
something was wrong and you're just
Yeah.
holding your breath. It's like he's in heart failure. They're admitting him to the cardiac ICU. And so I rushed there. I mean, this is not what we were expecting. It was not even
No.
on my radar. And so by the time I got to see him, he was already in the cardiac ICU. The team was amazing, the critical care cardiologists. And so they were constantly in the room. They started him on medications and they were watching him really closely. And then it was evening. And so I actually went home to put our baby to bed, pick him up from daycare,
Mhm.
put him to bed, relieve our um, sitter who was watching our other child. And I was actually putting our baby in bed when he called again and said, "You need to get back here right now. They're about to put him on ECMO." They had to put him on life
God.
support.
Yeah.
So I rushed back. Our babysitter stayed the night. Luckily, we have a lot of friends and family in Atlanta, which is helpful. And that was horrible because he was 11 at the time and he didn't know what was going on and he
Yeah.
was so scared.
Yeah.
And I wanted to be honest with him. I didn't want to lie to him. So I was honest, but I didn't just give the whole story. I just said, they have to do a procedure to allow your heart to rest to heal.
Mhm.
And it was another 2 weeks before we got to talk to him again.
Gosh. Oh my gosh, Heather. That's just and like you said, it comes out of nowhere. And I mean, even if you're like, okay, well, there was something that came back on the screening, but still, that's I just can't. I just that has to be just terrifying to not know what's gonna happen at that
Yeah,
point.
those were definitely the worst few months of my life.
And what do they they put him on the ECMO, and then at that point, is it a matter of being on a transplant list?
So at that point, they were hoping the ECMO. So the ECMO does the work of your heart and lungs. All your blood's pumped out of your body and oxygenated. And they were hoping that it would help his heart recover and that he can be taken off of it. But after a few days, it did not recover. His heart did not recover. And so the next step was to talk to the entire team, including the transplant team, about placing an LVAD first. It's a pump that does the work of the heart. And once you go through that, the plan is to transition to a transplant. And
Right.
so we it was a whole day of education. We met with the cardiothoracic surgeon and the critical care team and infectious disease about what life's like after a transplant and nutrition about what he can and can't eat. And we met
Mhm.
with palliative care and hospice and the social worker who I know really well.
Yeah.
I feel like she's part of the family. You know who you are. We love you. And so it was not good.
Well, and of course it was not good. How and I wonder how is it being somebody, right? So you're trained, you work in radiation oncology, not necessarily cardiology, not necessarily genomics, right? In terms that are dealing with like mitochondrial. Like, were you able to process what people were saying? I mean, I've talked to other folks that are just like, I just hear, like wah, 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 wah in the background. And I think sometimes people are like, oh, well, they have a background in healthcare. They're a physician, they're a nurse, but it's like, but they're the parent first or the patient first, right? And
Yeah.
so it's like, how? I mean, how does it? Did it matter that you have an MD or not to be able to
I,
process these
I
things?
actually don't usually tell people I have an MD.
Yeah.
Sometimes I feel like people treat you differently. I wanted to know basically what things were.
Mm-hmm.
But I was really in informat I was like a detective then. I was information
Mm.
gathering. I had my little notebook. I was charting everything down. I was doing all I could do at that point. I mean, they were keeping my son alive, and my job was to make sure that we were creating a safe environment, and I was doing my due diligence and learning everything I needed to learn so he could be his best self later. Is it helpful? I don't know. I will say at the beginning, I would get a beep every time labs came back from in his my chart and I was checking
Mm-hmm.
them and I would get nervous and I'd get scared. And it was like 2 days where I realized, I'm not managing his labs. I'm not his doctor. I'm there to advocate for him. I'm there as his mom. I'm an expert on him, and
Right.
they're an expert at taking care of him. So I kind of figure out what my role was so I can best help them.
Mhm. And so he has the transplant. Was that also 2021?
So actually, after they attempted to place the LVAD,
Mhm.
but he actually had internal bleeding, so they had to abort that. They
Mhm.
had to take him off the ECMO because that you're on so much blood thinners when you're on the ECMO, so they
Mhm.
actually did not think he was gonna make it through the weekend, but he did, and then a few days later, he got his LVAD, and then eventually, he was because he was on a ventilator too, so he was extubated. He actually woke up with a sternal scar.
Mhm.
He woke up with pacemakers, chest tubes, and then the LVAD actually, the drive line comes out your belly. So he woke up. He didn't know any of this was going to happen. We didn't know any of this was going to
Right.
happen. So that was its own transition. And then it was 6 weeks after the LVAD before he was even healthy enough to be placed on the transplant list.
That's what I was wondering is how.
He wasn't even healthy enough to accept a heart if we were
Right.
eligible to get one. And then it was, I think, 4 months after that when he finally got his heart. It was still in 2021.
And then I think what some folks I think some folks hear heart transplant and still understand it's amazing that we can do this, but also sometimes there's this, okay, they had the surgery, they're better now. Got the
No,
new heart in. Yes.
not at all.
No. And so I was gonna say, because you said you talked to, like, all these specialists even before it happened about, like, infectious diseases and other things. So what is that like, the process post-heart transplant?
So when you have a transplant, the things you worry about is rejection, either right
Mhm.
away or what's called chronic rejection. The most common reason people actually lose their heart is something called CAV or cardiac allograft vasculopathy. They don't really know why it happens, but the blood vessels in the heart, your coronary vessels, even the smaller vessels, kind of become smaller, obstructing blood flow. And eventually you're going to lose the heart. And so there's no way to diagnose it early, and there's actually no treatments for it. And I know families whose children have lost their heart because of CAV. The other problem is the immunosuppression. So the immunosuppression medications are preventing you from rejecting your heart, but they have so
Mhm.
many side effects. So they can cause kidney damage, and in some cases, patients even they can cause kidney failure, and some people may even need a kidney transplant from the medication. It increases your risk for infection. It increases your risk of getting cancers. And that's something I remember just from residency. Something that stuck with me is that I had seen patients who had had kidney transplant many years ago, and they just had multiple skin cancers all over their body because their body, you can't fight when you're
Right.
immunosuppressed as well. And so they would have multiple Mohs procedures, and then we'd be treating them with radiation. And so those are the things that were in the back of my head when I knew we were going through this journey. And then with rejection, at least the gold standard to make sure you're not having rejection is to do biopsies of the heart. So
Wow.
they either go in through the neck or they go in through the groin. And when you have a son with mitochondrial disease who's sensitive to certain medicines and who can't fast, he
Right.
actually had metabolic strokes just from fasting. Most people, when you go to the hospital, you can't eat anything after midnight. You
Right.
can't do that when you have mitochondrial disease. They can't be in any catabolic state where they're fasting because it can cause and precipitate a metabolic crisis.
Mhm, mhm. And so he's not able to do some of those things for the heart transplant, post heart transplant, and because of the mitochondrial disease. So how is all of that managed with, I mean, I'm guessing just a team of, like, specialists who work in these different areas? Because, again, like you had mentioned, mitochondrial, it affects a whole bunch of different parts of the body, but then you have the focus on supporting him post-transplant with trying to fight rejection and things like that, but it's, how do you find providers that can understand, I guess, the term we would probably say is like a comorbidity, right? These two
Yeah.
different types of things. How do you find folks that can treat that? I mean, is that Was that part of the team at CHOP? Was that somebody here in Atlanta?
So we have an amazing heart team at CHOA, Children's Healthcare of Atlanta,
Mhm.
that reached out to our mitochondrial team at CHOP, Children's Healthcare of Philadelphia. And so them communicating was so amazing because I know that can be difficult. And unfortunately, there's not that many mitochondrial specialty centers throughout the country. They're very few. And so that's why we have to fly to Philadelphia. I'm hoping in the future that there'll be more
Mhm.
as we train more clinicians to take care of patients. But we actually learned a few things the hard way. So he actually did so well after his heart transplant. He was able to go to a regular floor by 4 days after surgery. He was out of the ICU on a regular
Mhm.
floor. He had no appetite. Like he was sipping Gatorade. He was getting some sugar through his IV, but he had been dealing with this for a few years before that, and he knew his body and he knew what he needed. And so he actually
Right.
asked for a feeding tube.
Wow.
He asked for an NG tube to
Mhm.
feed him until he can eat again. Um, and this was a weekend. Our regular team wasn't there. And so they kind of looked at us funny, like, what 12-year-old asked for that? It was a little, maybe
Yeah.
from their standpoint, odd, and I was pushing for it too.
Yeah.
But within 30 to 40 minutes after he asked for that, he actually had another stroke because he was
He could
fasting.
tell. He could tell.
Yeah.
Yeah.
He knows when he's not
He's lived
feeling
with this.
great.
Yeah.
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 For him, he always says, I think I'm about to have an episode. And there's certain things he can do, like sleeping and eating and drinking sugar, that can sometimes minimize it or prevent it. But normally, if it's going to happen, we need to be at a medical center where he can get IV fluids, where he can get an IV with IV dextrose or sugar. And if he's having a metabolic stroke, they treat it with IV arginine, which is a vasodilator to increase blood
Mhm.
flow to the brain.
Okay. So, and that was actually my next, how is he doing today?
He's
4
doing
years
good
later.
today. He's doing
Okay.
good
Good.
today. So he
Mhm.
had his 4-year heart anniversary. We
Mhm.
we go to CHOA every year and serve meals on the heart floor, and we get to see our old team. So he's doing well. He hasn't had a metabolic stroke in 2 years, and we have been lucky that we have access to a medication called elamipretide that we are accessing through CHOP through what's called an expanded access program. So Elamipretide is a medicine that makes your mitochondria work better. It basically stabilizes the mitochondria, it binds the inner mitochondrial membrane, and it makes your heart muscle work better and it makes your skeletal muscle work better.
Mhm.
And so it's being used to treat patients with mitochondrial disease with heart failure. I mean, it didn't exist when my son went through that, but it's also used to improve strength in your skeletal muscles and in the rest of your body. So for him, it's been a game changer and improving his quality of life. He used to fatigue very early. He couldn't walk
Mhm.
that far. He would have to take breaks. He'd get muscle cramps. And I
Mhm.
think it was 6 weeks after starting this where he's like, Mom, I don't get muscle cramps anymore. And he wanted to do sports again. So he signed up for the tennis practice squad. And
Mhm.
first he had to be driven there. It was only a mile, but he just didn't have the energy to walk there. And then
Mhm.
he was walking there, and then he was walking there and doing practice, and he didn't complain at all. And then the last 2 summers, he's had his first job. He's a tennis counselor at the Emory tennis camp, indoors, of course, because
Mhm.
Mito kids don't do great in Georgia heat. But his quality of life has improved so much. And now he's 16 and he's starting to work out and even work with a
Yeah.
trainer. Like, his life has changed a lot. And I've heard many stories of both children and adults who are on the medicine where it's either improved their quality of life and or for children or patients with heart failure, it's actually gotten infants who are on the transplant list off the transplant list, out of the ICU and at home.
Wow. Wow. So they ended up after taking it's elamipretide after they've been taking this medication, then they end up not needing the transplant anymore.
Yes, there have been
Wow.
reports of patients not needing their transplant. There was a baby who had an LVAD placed with the plan to go to transplant. They actually had the LVAD removed because their heart function was, and that's very rare to have an
Yeah.
LVAD removed because their heart function improves so much.
And I've heard of this medicine, and actually this is how I found you on LinkedIn and a few other folks because there was discussion around the elamipretide, and I always want to make sure I'm saying that correctly, because it has made such a huge difference for folks with some of these mitochondrial disorders, especially those involving the cardiac function. But there's concern right now that that may be going away, that they may be losing that medication. So, can you explain what's going on or why that's happening?
Yes. So the manufacturer health industries, they have been working with the FDA about since I believe 2019. Um,
Hmm.
in creating the studies that were ultimately done. There have been a lot of delays. The drug application got bumped to 4 different divisions, and ultimately last fall in October of 2024 they actually voted to approve the medication, and
Hmm.
then they were supposed to meet in January, and then the FDA just missed that meeting. And then there's since been more delays, or the FDA is asking for information, some of which they already had, which
Hmm.
I've been told per report and per all of the media stories that I've seen in the papers and
Hmm.
on TV. And so, because of all the delays, what should have been an expedited 6-month process is now coming to almost 2 years. And so the company is concerned that they're going to lose all of their sponsors. They actually laid off a third of their workforce to focus only on approval for children with heart failure right now. It's been studied on other mitochondrial diseases as well. And they're worried they're going to lose all funding by September, so later this month.
Oh my
So there's
gosh.
concern that all patients who are receiving this medication may lose access to it.
And so it's because there's been something, and I go ahead and preface, and you and I have chatted a little bit about it. We're not experts in FDA regulatory. I've dealt with it in my
I'm learning a
past
lot.
life in terms of oncology medications. But I remember when it had gotten that initial approval, because that was huge for those of us in the genetics community, because that's where we want to get ultimately, is to have medications that can help treat genetic causes of disease. And then to see it potentially fade away, especially for people where, I mean, do they have any speculation about what would happen if this drug goes away to the kiddos, to the adults that are taking it?
So I've talked to some moms whose children are on it for heart failure,
Mhm.
and they have talked to their cardiologist that if they lose this drug, their child may have to go back on the transplant list. I mean, that's totally unethical and heartbreaking to take a medication away from a child that's keeping them alive and healthy. No one should have to go through a transplant if they don't need to. I mean, I would only recommend it if that is their only option. If there's a medication that could prevent it, I mean, there's no choice there.
Yeah, and like you said, it's been studied in other mitochondrial conditions, but at this point, because of fighting to keep the medication available, they've had to just focus on those that need it the most, right? Which are the ones that are having heart failure, that are could potentially be on the transplant list. So there's other folks that can benefit from it, but right now it's just even focusing on the highest priority need.
Exactly. So right now we're trying to get it approved for children with Barth syndrome. So Barth
Mhm.
syndrome's a rare mitochondrial disease where young babies, usually young boys, can develop heart failure within the first month of life. And many children may not live outside childhood. And so right now the focus is to get it approved for Barth syndrome where it's so critical. They've
Mhm.
also completed studies in patients with primary mitochondrial myopathies with nuclear mutations, and that's how we are getting access through the medication. But it's also being studied for ocular conditions like macular degeneration and for other conditions as well.
Mhm.
So if
Mhm.
we lose this medicine, it could potentially hurt many people with many different conditions.
Right. Well, and I think the thing is, like, we talked to a few folks that have either what's classified as a rare condition or ultra rare condition, right? And I'm saying these in air quotes, because I think one of the things that we're finding is either one, as we have better technology testing, learn more about genetics, we find that maybe some of these things are not as rare, or even if they are rare, they apply to so much more outside of that condition. So to have a
Hmm.
medicine that can work against heart failure doesn't just mean it's just for these folks in this mitochondrial population. It means it can teach us a lot and we can potentially utilize it in many other ways for many other populations and people that experience issues with heart failure.
Yes.
Beyond this, this is sort of the starting point, but then we have the ripple effect. But we could potentially lose that if we aren't able to have this starting point to make sure we can use the medication effectively.
Yeah. Yeah. So hypothetically, it could potentially be used for other conditions because mitochondrial dysfunction is found in different causes of heart failure as well. So I'm
Mhm.
speaking hypothetically right now.
Yes, yes. Again, we're not the experts in it, but that's kind of like one of the takeaways I have is there are implications outside of the rare disease sphere potentially.
Yes. Yes.
Is there anything that listeners can do to either lend their support or to make their voices heard? Or are there other resources that are actively working on this that they can support, like other nonprofit groups or something?
Yeah. So if you want to get more information, you could reach out to the BARTH, Bar Syndrome Foundation, and the United Mitochondrial Disease Foundation is umdf.org. And if you have contacts in Congress or media, we would love your support. We're doing a social media challenge right now that you may have seen, the Shots
Mhm.
for Shots challenge, just to increase awareness, to help support the approval of elamiprotide. And if there are patients who are concerned or learn more about mitochondrial disease in general, UMDF website has some great resources. They started a page called MitoU, which is Mito University. And so there's educational resources for patients and for doctors. So that's a great resource. And we actually have an annual mitochondrial medicine meeting for patients with mitochondrial disease. And it's the most unique medical conference I have ever been to. So I usually go to large oncology conferences where there's
Mhm.
thousands of people. I can't even find people I know who I know are there. At these
Right.
conferences, there are the clinicians and doctors taking care of the patients. There are the patients themselves and their children and families. So there's a patient and family and sibling track, there's a clinician track, and then there's a researcher track. And we sometimes combine or in the same room at the same time. It is so inspiring. And we do different grants to fund young researchers. And so patients and their families actually get to vote on who gets awarded the
Wow.
grants. It was my first meeting this past June.
Mhm.
And then we'll have another one coming up this upcoming June in Orlando. So it's unique in that both patients and families and children are all welcome. And so you'll
Mhm.
actually be in medical conferences where there'll be strollers and babies and doctors all in the same room learning from each other. It's quite inspiring. And I've talked to a number of the researchers and postdocs and fellows, and it's so rewarding for them because they're normally in a lab. And to see who their research is impacting is so
Mhm.
powerful.
It is. It is, and to remember, I mean, this is ultimately why you're doing the work, right? Is
Hmm.
the patients, that need it, and so, so we'll put a link, to that in the show notes. It's the United Mitochondrial Disease Foundation. So it
Correct.
sounds like they're a really good resource. Are there other resources or any things that you would recommend to families that are either thinking about, maybe facing the mitochondrial disease or are in the case where they may have to be considering or are facing heart failure and thinking about considering a heart transplant?
So, Enduring Hearts is a wonderful nonprofit. It supports pediatric heart transplant research and funds grants internationally. So, they are trying to improve the longevity, the lifespan of children who've had a transplanted heart. When our son had his transplant, we were told the median survival is about 17 years. And so they are working to improve not only the length of patients' lives, but the quality of their lives. So they're
Mhm.
supporting research for less invasive tests. They're trying to find a early way to diagnose CAV and to treat CAV so less patients lose their heart. And I also want to shout out Transplant Family, and that's for all patients who've experienced a transplant. They actually have a great 1 day online virtual meeting for families where they talk about issues like fertility. Can my child have children in the future if they want to? They talk about vaccines and diet and exercise, and it's a great meeting as well.
Okay. All right, we'll include all of that in the show notes. I appreciate you taking the time to not only share, your personal experience, but also some of the volunteer experience, that you've had as well. If our listeners walk away and they take away one thing from the conversation, let's say they remember one thing. What's the thing that you think is most important for them to remember out of this 30 plus minute conversation?
I would say we think there are more people with mitochondrial disease out there that are just undiagnosed at this point, that it's caused by both nuclear and mitochondrial DNA mutations. And I would say that you can't tell by looking at someone that they have mitochondrial disease, that you need a genetic diagnosis.
Right, right. I think that's very important to remember. Is there anything that we haven't covered that you want to make sure that we touch on?
I would say if there are any doctors, nurses, APPs on the line to consider a diagnosis of mitochondrial disease if you're seeing a person who's having some what's called new onset strokes or stroke like episodes or metabolic strokes, or you're seeing new findings on an MRI where they're either having T2 or flare intensity that can or may not be symmetric. If you're seeing new onset seizures, if you're seeing 3 or more organ systems involved, um,
Mm-hmm.
uh, a diagnosis of diabetes and hearing loss early in life is also very suspicious for mitochondrial disease. And in those cases, that's when you want to get medical genetics involved.
Hmm. That's very good that you
That was
highlight
more
that
than
because
one thing.
I like all good things, but I was like, you're mentioning all these things, and I go, yep, I remember. That was all what I studied for boards, the red flags, right, for mitochondrial conditions, and that's when you need to start thinking about it. So I think that's very helpful. So something for everybody, whether you're a patient, family member, or practitioner. But again, just Heather, I appreciate you taking the time to be with us and to share your story and your son's story with us today.
Well, Kate, it was great to see you. Thank you so much for having me on.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all the episodes of the show. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Please rate and review the podcast on Apple, Spotify, YouTube, or wherever you listen. This helps other people like you discover the show. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. All Access DNA is an independent podcast hosted and produced by me, Kate Wilson. Designs by NKJ created the logo. Thanks for listening and join us next time.